So I spoke about the eustachian tube the other day, and I now want to continue from where I stopped. Okay, now if your eustachian tube is not working well, that means air is not getting into the middle ear. First thing that happens is that as the little air that is in there gets absorbed by the body, you have a vacuum. That's nothing in there. Nature abhors a vacuum, so nature will respond by filling up that space with fluid. Now, the initial vacuum can cause you a whole lot of pain, a whole lot of sharp pain in the ear. Then as the ear starts to fill up with fluid, it becomes uncomfortable, and then you can actually feel something moving around in your ear. And then with time, it gets so full, and then it now is under pressure. So it gives a dull kind of pain. Now, this dull kind of pain is associated with things like hearing loss, noise in the ear, loss of balance, and general just unwellness, a feeling of unwellness in that area, that your ears just don't feel right. Okay, so when we treat, first and foremost, we have to investigate, or we have to examine. We have to look at the eardrum, because the eardrum has a peculiar appearance when you have fluid behind the eardrum. That's why you have to see your ENT, because we can't just always tell what the problem is just by hearing your story. So the eardrum has a peculiar appearance. Then we do some testing. We send you for what we call a tympanogram or tympanometry, and we also do some hearing tests like the pure tone audiometry, just to figure out what's going on with the pressures behind your eardrum. Painless tests, let me put it like that. Then you've now confirmed that this is going on. You now want to wonder, why does the patient have it? And you get that from the history, generally what the patient tells you, and for questions that you've asked the patient. Okay, you've now confirmed there's fluid behind the ear. What do we do? Remember, I said the eardrum seals off this part of the ear from outside. So the treatment of eustachian tube dysfunction isn't by putting eardrops in and this thing. There are drugs that are used, decongestants, steroids, measures such as what we call the Valsalva maneuver: pinch your nose, close your mouth, swallow, pinch your nose, close your mouth, blow. We have other methods like using antihistamines to reduce the reaction that causes a lot of swelling around the eustachian tube. We might also have to resort to surgery. And in surgery, we might have to put a little tube in the eardrum to allow air go in from this way instead of going in from the other way. In children, sometimes we have to go to the space behind the nose, remove what is there, and that's usually adenoids in a little child. And there are other surgeries that are not readily available in this part of the world called the balloon dilatation of the eustachian tube. But all in all, first you have to be properly assessed to know and confirm that your eustachian tube is not functioning, and then we can now decide on what the cause is, and therefore what the treatment is. Have a good day.